Hi everyone, thank you so much for joining us today on International DNA Day. My name is Tanya Haas and I am the Health and Wellness writer here at MedCan. Before I introduce our presenters today, I wanted to start by sharing that this presentation is being recorded and will be sent to you up in follow-up emails tomorrow in around 24 hours, so you will get a recap. You can also find previous webinars that we've done here at medcan.com under MedCan Insights online. Now, due to the number of participants we have with us today, we have muted all incoming audio. And during the presentation, if you have questions related to what's being discussed, you can submit those questions right here on the slide on your screen. So you'll see there's an area where you can see questions. We've circled it here. You can type your questions. Your question will remain, whoever sent the question will remain anonymous. And we have left some time in the presentation today to address some questions, but we may not get to all of them. And so today we will also be briefly outlining some of the psychological and genetic services that we have at MedCan, and we do have a special offer for all webinar registrants to thank you for joining us today. So please hang on to the last slide and you'll hear about that. And finally, remember the information being shared today is for educational and information purposes only. It is neither intended to be relied upon nor to be a substitute for professional medical advice, diagnosis, or treatment. Now, with all that being said, let's start this International DNA Day off right and meet our panelists. So here we have Alison Hazel. She is a Canadian and U.S. board-certified genetic counselor based in Toronto. She is past president of the Canadian Association of Genetic Counselors and has served as a board member in varying capacities since 2013. Ali joined MedCan in 2010 and prior to this held a position in the Adult Genetics Clinic at University Health Network and Mount Sinai Hospital. Ali earned her master's in human genetics from St. Sarah Lawrence College in New York and holds her certificate in public health genetics and genomics. Ali, how are you today?
I'm good. I'm excited.
Great. So am I. All right. Also, to my left, we have Gina DiGiulio. Dr. DiGiulio is the Director of Psychology at MedCan. She is a clinical psychologist. She obtained her doctorate in psychology at the University of Ottawa and earned a master's in law with a health specialization from Osgoode Hall, followed by a wide array of teaching and clinical practical roles in Ottawa, Stouffville, York, and Queen's universities. At MedCan, Dr. DiGiulio sees clients for a wide range of conditions, including stress and anxiety, depression, and relationships counseling, and she is often consulted in individual counseling, organizational psychology, as well as corporate wellness programs. Dr. DiGiulio, thank you.
Thank you.
And joining us from British Columbia, our very special guest, and we're so honored to have her joining us, Angela Inglis, who is a psychiatric genetic counselor from the ADAPT Clinic, which is a Vancouver-based provincial genetic counseling, and Angela will tell us how it is one of a kind, one in the world. She's also a clinical associate professor at the Department of Psychiatry at University of British Columbia, and she is a workshop facilitator in psychiatric genetics for genetic counselors, so she does trainings for healthcare providers in the field. So Angela, can you hear us?
I can. Can you hear me?
Yes, thank you so much. We're so honored to have you joining us today.
Thank you so much for inviting me.
Thank you. Can you tell us a little bit about the ADAPT Clinic and what makes it one of a kind?
So the ADAPT Clinic is a psychiatric genetic counseling clinic based at Department of Medical Genetics here in Vancouver. We are the first in the world to provide genetic counseling solely to people who have a personal and or family history of mental illness. And our group, the Translational Psychiatric Genetics Group, we did a lot of research that looked at the effects of providing genetic counseling to this population and to see if people in this population wanted to have genetic counseling once they understood what it was. And we found that it is extremely beneficial and that people do really want this service. So just as a kind of a bit of background, genetic counselors are master's trained healthcare professionals who help people to adapt to the psychological, medical, and familial implications of the genetic contribution to disease. So that's our National Society of Genetic Counseling definition. And so what that means is that we help people understand how condition might get passed down in a family, the genetics that might be involved, as well as the other factors, such as life experiences and such, that might contribute to someone developing a disease.
Okay, great. Yeah, that was my first question. So how does genetic counseling differ from psychiatric genetics counseling? And we have this graphic here from your clinic. Can you tell us a little bit more of what makes psychiatric genetic counseling so distinct?
Well, I mean, I would say it's distinct in that we are focusing on the psychiatric population. How our clinic, I guess, is different than other clinics is because we are the first in the world. We've been able to decide how we want, what makes most sense for our patients and how our clinic runs. So we do end up seeing fewer people, and we do end up having usually longer appointments. And that does allow us to get into more of that discussion of the spending more of the time addressing a lot of the emotions that come up when you're talking about where does an illness come from.
One of the reasons why we wanted, and we're so excited to have Angela here, is that, this is an area, I think there's sort of a groundswell of movement in the mental health space, generally speaking, where a lot of the big initiatives to help reduce stigma are really, we're kind of seeing those working. And so at MedCan, what the genetic counseling team finds is that, it's much more likely that our clients are willing to talk about either their personal or family history of mental illness and start asking these questions. And so I think it's an area, as people are becoming more comfortable talking about it and clinicians are more comfortable talking about it, this is a really important service for us to really address the kind of genetic impacts of psychiatric illness and help include that as part of the education around how we understand mental illness in general.
And on the flip side of that, I'll say on the clinical side, one of the questions that I get asked most often by my clients is, especially those who have a mental illness, is, am I going to pass this on to my kids? Mm-hmm. And so they're very curious about the links between mental health and genetics.
Yeah.
And just, yeah, so a lot of what we do is very much addressing any of the feelings of shame or guilt or stigma that might be going on with having a diagnosis in the family, as well as answering those questions on what this might look like for future children. And what we're learning a lot in this clinic is that I think sometimes we think that as genetic counselors that people want to know a particular percentage of what that chance might be. But oftentimes after doing genetic counseling with family, what it is that they more wanted to know was that it's not a guarantee and that there are things that they can do to protect mental health, more so than actually wanting to know a particular percentage of what that number might be.
Could we talk about, nature versus nurture, environmental factors versus genetic factors?
Yeah, definitely. So what we know from research about the causes of mental illness is that it's brought about by a combination of things. So it's brought about by genetic factors, so what we're born with, and life experiences or stresses that we might have in our life. And so we use this analogy of a mental illness jar. And it's this idea that because everybody has a chance to develop a mental illness, everybody has a mental illness jar. And what can go into that jar are what we're born with, that genetic chance or vulnerability, and those environmental factors or life experiences. And if we go to the next picture, this is just to show that, so as I mentioned, everybody has some of that genetic vulnerability, but nobody is born with a mental illness and nobody's born with their jar full to the top. So what can happen over time is that some of those life experiences can add in. So that can be having a complicated birth or a childhood head injury. Those things can add in over time until someone might fill their jar up to the top. And that's when someone would experience symptoms of illness like depression, anxiety, schizophrenia, bipolar disorder.
So I love this visual. It was just so helpful because at MedCan we've been writing and we cover psychology and mental illness a lot, but I've never used this analogy before. So when it says unaffected, there are things that within your control, but complicated birth, that doesn't seem like a genetic aspect. That's
a triangle adding in. Yeah.
Ah, that triangle. I see. Okay.
Yeah. So the things, the genetic aspects, those, you're right. That's not something that we can control. That's what we're born with. Our parents have no control over what they might pass on to us, and we have absolutely no control over what we might pass on to our children. Other things that we can't control are things like having a complicated birth or having a head injury during childhood. So these are triangles that add into our jar. Other things that might add into our jar are having a breakup of a relationship or maybe using street drugs. So all of these things on their own wouldn't be causative of an illness, but they all can contribute.
Okay. When you, Gina or Ali, when you speak to your clients and you talk about this, do you talk about this? I mean, is it discouraging for people to hear this type of thing, or how?
No, I mean, it's framed positively, right? Even if someone does have a genetic vulnerability to a mental illness, there are always things that you can do, and we're going to be talking about this soon, in order to decrease the likelihood that that genetic vulnerability is going to be activated, right? So although developing a mental illness might not fully be within our control, there are still some things that we can do that are in our control that will decrease the likelihood that the mental illness will be activated.
And I think I'd also add that, you know, if you know that you're starting out with a genetic vulnerability, that can be useful in helping to kind of, make sure that you are being as proactive as possible if you know that you're at risk for it.
Mm-hmm.
So Angela, I'll move to the next slide. Maybe you could tell us what's happening here.
Yeah, I think this is just to show, so as I talked about, everyone has some of that genetic vulnerability. It's just to show that everyone starts off with different amounts of that genetic vulnerability. And so just as Ali and Gina were saying, this first part of my discussion is showing how mental illness can develop. But this isn't, of course, a one-way thing. We'll talk a little bit about recovery and protecting mental health, but people can start off with, you can imagine if you start off with a smaller amount of that genetic vulnerability, it might take potentially more time or more life experiences before somebody might experience symptoms of illness. And so that could be somebody who maybe experiences symptoms of illness at an older age. Whereas if somebody is starting off with a little bit more of that genetic vulnerability, it might take less time and less of those life experiences before they get to that point of filling up their jar.
Right. So we know that with mental illness, there's so much stigma, and oftentimes people say, well, it's my fault. I'm not doing things properly. I'm not eating well. I'm not sleeping well. But this kind of shows to some extent I mean, Gina, when is it your fault? Or is that that's probably not the right term, right?
Right, probably not a good term to use. And this is controversial. I'll turn it over to Angela and Ali to speak to this, but there are some mental illnesses that, for which are more explained by genetics rather than environmental factors. Schizophrenia comes to mind as an example. So, for example, your mental illness jar might be fuller with those genetic vulnerabilities if you are prone to schizophrenia. So although with schizophrenia, there's still things that you can do to maybe prevent the illness, or definitely there are things you can do to manage it. That illness is more, I guess, affected or triggered by genetic factors, right? So it's never your fault because there are always things that you can do to varying degrees depending on the illness that we're talking about. But because there's always that genetic component, right, it can't fully be your fault. It's never your fault. There's always things that you can do.
Angela, did you want to jump in there?
Yeah. So I just want to say it's never anyone's fault. We know this from research, right? We can't control our genetics. We can't control we can control some of our environment. We can't control everything. Stress happens. And sometimes stress is a positive experience in our life. It could be a stress of a wedding or a stress of going on vacation or going to a new country. So it might not be that these are negative things that happen to us in our life. Sometimes these are positive things. And I think this jar model does actually work similarly with schizophrenia. You could imagine that somebody could be starting off with potentially a bit less of that genetic vulnerability. Like it can kind of vary with sort of how much might be genetic and how much might be environmental for all genetic conditions. There's going to be a range, and then we can kind of see that with the severity of someone's symptoms or how early someone was when maybe they first started to experience onset of illness.
Thank you so much. Thank you. Yeah, so you showed us this slide. So can you just explain what's happening here? And it's that beautiful curve we often see. So how does this relate to what you're speaking to?
So this is just a normal distribution curve. So you could imagine if we're not at a point yet where we understand all of the genetic changes or vulnerability that are involved in contributing to someone developing an illness. But if we were actually able to line everyone up in the general population based off of how full their jar was, most people would fall in sort of this moderate risk section. Some people would have a smaller or a lower amount, and some people would have a higher amount. But this is just to show, I mean, we know mental illness is so common in the general population. This is just to show that you know, why that might be or why that is, because we all have a moderate chance to develop, or most people have a moderate chance to develop mental illness.
So I would imagine when you're speaking to your clients that oftentimes are they asking you, what are the risks for my children, or what are the risks of my siblings, or what are some common questions that you're getting with your clients?
A lot of the questions are, you know, why did this happen to me? Or what did I do to cause this? People do want to know, what does this mean for my children? And with the what does this mean, I think we sometimes interpreted that to people wanting to know a percentage. But what we're finding is that what they're wanting to know is this a for sure thing? Are there things that I can do to protect mental health?
Right. So the family question is quite common. This is what we see here. Can you just tell us what's happening?
Yeah, and this is just to show, you know, why it is maybe one person in the family developed a mental health problem and the other one didn't. You know, perhaps, and this is just an example, so say perhaps dad starting off had a bit more of that genetic vulnerability, and mom had a little bit less, but they both would have some because we all do. How that might get passed on to their children is going to be totally random. So you can imagine that, you know, one of their child, like if they had 4 kids, you know, maybe one had a bit less of that genetic vulnerability, one had a little bit more, maybe 2 had a little bit more. And so it could be that in a family with the person I'm speaking with, maybe starting off, they had a bit more of that genetic vulnerability than say their siblings. And that in combination with their life experiences is what led to them filling up their jar.
Thank you so much.
So I think one of the questions, or one of the things we see, I guess, a lot with when we're taking family histories with clients at MedCan is that there are you know, certain situations where you see the same mental illness in the family or different mental illnesses. So Angela, I think we were hoping to get your take on kind of that question around, do the same mental illnesses always run in families, or what's the data around that?
Yeah, so it's just an example of like a family tree. But so just to orient you, circles represent the women in the family, squares represent the men, and the shaded circles represent different diagnoses in the family. And so it's really, really common for me to see family histories where there's lots of different types of mental health conditions in the family, like depression, anxiety, bipolar disorder, schizophrenia. And so what we are learning about mental illness is that the genes that make us more vulnerable to developing a mental illness, it's not that they're specific to a particular condition. It's not that this is a gene that's going to increase our chances specifically to bipolar disorder, specifically to depression. It seems that there's a shared genetic vulnerability, and so that it increases your chances to mental illness in general. And so that's often why, and there seems to be quite a lot of shared genetic vulnerability with depression, anxiety, and bipolar disorder, sort of, and that can kind of explain why we will often see those different conditions within the same family.
Angela, if I could just jump in, I've never heard this before, and I'm not an expert, but so if I'm understanding correctly, so say there is family history of schizophrenia. Yeah, that doesn't necessarily mean there will be schizophrenia moving forward in the line, but you're just more susceptible to possible depression or anxiety or bipolar disorder. So if I have bipolar in my family, that doesn't necessarily mean that my children will have bipolar, but they may have depression. They might, okay, wow. Gina, is this something you've heard of? Is this research you know about? Or
Yep, I would agree, and I definitely see that when taking histories with my clients as well. So it's more of a, as Angela said, a general sort of vulnerability to mental illness that's passed on rather than a specific one to a certain illness.
Yeah, so certainly if you have a family history of bipolar disorder, you have an increased chance above the general population of having bipolar disorder. If it's like a first degree family member, such as a sibling or a parent. Yeah, in general, it sort of increases your chances to mental illness in general.
Okay, well, that's great, because we know people with family members with schizophrenia, with bipolar, with depression. We all do, but it's nice to understand this kind of spectrum. So I have a question for Ali at this point. So how do you field questions, Allison, on the genetics of mental health when you're working with clients?
Yeah, so I mean, as I mentioned at the beginning, I think we take family history kind of as a standard part of most genetics consults. So we're always talking to people about their family history, and typically it's, someone's here because they're concerned about their family history of cancer or heart disease. But what we're seeing in the clinic is that you come across mental illness in I'd say, the majority of family histories. And what we're seeing is that people are asking about it more and more. So, an example is, family history of suicide. I think there used to be a lot more hesitation around mentioning that in that sort of consult, versus I think that we are seeing the stigma kind of falling away and people more open to talking about it. So we're fielding more questions from that side of things. And then we also end up talking about mental health a lot because of pharmacogenomic testing, which I'll touch on in a little bit. But we're seeing a lot of people who are seeking out medication sensitivity testing related to psychiatric conditions.
So with regards to the suicide mention you just said there, so suicide is not a mental condition, it's just a byproduct of, or often is.
Right. And I think, but it is part of the stigma that goes along with it. And I mean, this is mainly anecdotally, but noticing that people are more comfortable discussing that. I don't know if you see that, Angela or Gina.
And I think with that is that sometimes that person was never diagnosed. Like, it's really common for me to take a family history and they're like, well, I don't know what was going on for them, but they died by suicide. And so you make the assumption that there was likely depression or something going on, but there was maybe there was never a formal diagnosis. It's similarly to things that people will talk about, like nervous breakdowns in the family. So we're going further back in generations. Sometimes there was not that person never sought help for their mental health, for their mental illness. So I do think people are seeking help more, which is great. And that, I mean, suicide is something that unfortunately, because that means that happened in the family, is getting discussed more. But on the flip side, the good thing is that it's hopefully that the stigma is getting reduced around that.
Well, definitely. I think the fact that we're talking about this today so openly is representative of the openness and reducing of stigma. And there's suicide, there's also institutionalization. There were lobotomies a few generations ago. I mean, we've come a long way. So let's move on to my next question, which is, if I'm at an increased risk because of, say, looking at this family tree and mental illness, how can I prevent the onset of mental illness, and how can I manage it? So, Angela, I'm going to ask you, and then I'm going to hand the mic over to Gina.
Okay. So unfortunately, we can't prevent anybody from developing a mental illness. If we could, we would be telling you all the formula on what you needed to do. But it's not something we can prevent, but we can certainly do things to help protect our mental health. And so as I mentioned, and these the things I'm going to discuss are the same things that you would want to be doing to help with recovery as well. We're having recovery from an episode. So we all start off with some of that genetic vulnerability, as I mentioned, when we're born, and we all experience stresses in our life. These can be things that we might consider bad things that happen to us, as well as things that might be positive or exciting things, but came along with stress. But there are things that we can do. So we were talking about a jar. So as I mentioned, we can't prevent, so you can't stick a lid on top of our jar to prevent those triangles from coming in. But what we can do is try to make our jar bigger by putting rings on top of our jar. And these rings are meant to represent the protective factors. And so these are things that we know from research that can be really important for protecting mental health. And these are things like trying to get really good sleep. And when, you know, we are under times of stress, sometimes that can be difficult to do. But knowing that getting good sleep is really important for our mental health. When we're not sleeping well, that's the triangles adding back in. Social support, exercise, and trying to eat well. All of these things can help to try to make our jar bigger.
Right. Yeah, so here at MedCan, Angela, we say eat, move, think. And so we say this a lot, eat, move, think, and think also encapsulates sleep. So Gina, did Angela miss anything, or would you like to add to something that Angela was speaking to?
Right, so I agree with Angela. So there's no surefire way of preventing mental illness, but if you increase the known protective factors of mental health, then you can decrease the likelihood of mental illness onset. So what are the protective factors? Well, as Angela mentioned, the number one thing to control in your life would be stress. I say to my clients that stress is like the great light switch in life that will activate any genetic vulnerability that you have to mental illness. I don't know whether Ali or Angela sort of agree with that image, but or to use Angela's jar metaphor, stress is a big triangle. So it's going to fill up your jar much more quickly. It takes up a lot of space. So keeping stress under control is a really important thing. And, you know, you can't always control all of the stressors in your life, but you can learn to control how you react to them. And one of the best ways to do this is through self-care, so through that eat, think, move that you talked about. We know increasingly more and more that the role of sleep is so important, both in sort of triggering or being responsible for triggering a mental illness, or certainly in managing it for those who have it. So getting sufficient sleep is really important. And also, if you do have a mental illness or have a history of a mental illness, I think it's really important to know what your specific warning signs are and really pay attention to them. Because as with physical illness, we know that with mental illness, the earlier you intervene, right, the more successful you're going to be in terms of managing that episode successfully.
Yeah, so Gina, I just pulled up this slide that you've brought up in a few webinars before. Angela and Ali, please pipe in whenever you feel like it. But here we have the spectrum. So Gina, can you just speak to that? I think you were talking to it right now that there is a spectrum and you have red flags. So
sure. So the mental health continuum model was a model that was developed by the Mental Health Commission of Canada, and it illustrates the spectrum of symptoms that people exhibit when they're dealing with mental health issues. And this shows that mental health is not binary, but rather runs along a spectrum of possible symptoms. The model also offers some examples of some symptoms that might occur along the spectrum as one moves from healthy to ill, or within the green zone to the red zone, and also some actions that people can take at each phase of the continuum. And, you know, all too often people wait to intervene when they're ill, right? When they're within that red zone. And as I previously discussed, intervening early, preventative treatment is always best. It's much better to intervene when you're in that green zone or the orange zone. You know, we do this with the dentist, for example, right? We'll see our dentist, most of us, maybe 2 times a year, 3 times a year, even if there's nothing wrong with our teeth, right? I just went to the dentist last week and she said to me, you know, how are your teeth? And I said, great. Any problems? No. She didn't say to me, well, then what are you doing here, right? We still go nonetheless. So we have to take the same preventative care of our mental health that we do with our physical health.
Angela, I have a question for you. When you're seeing clients, where do you think they are on this spectrum?
They are run from healthy to ill, just depending on where I'm seeing them. I see people here in the clinic. I also go to hospital to meet with patients as well.
Okay, and what about you, Ali?
So generally speaking, I think typically for our programs, we're seeing healthy individuals. One area is around that psychiatric pharmacogenomic testing that we're seeing. So we do meet with a lot of people who are who have a diagnosis of depression or anxiety, for example, who is have a diagnosis of depression or anxiety and is interested in trying to optimize their medications, having difficulty with certain medications, and wanting to see if there's any way we can provide some information from a genetic standpoint on how to optimize their medication therapy.
Thank you so much. Yeah, I find this model really helpful because it cues us to when you can seek help. So I'm getting new perspectives. Gina, when do you recommend that someone? You just said it that so are you saying that someone can see a psychologist or a psychotherapist when they're feeling fine? And
yes, absolutely. So I have clients here at MedCan that I see who are within that green zone. Okay, they're completely fine, but they like to see me for what we call just the mental health checkup. You know, and these are clients who see me, you know, as they say, maybe every quarter, just to make sure that, you know, they're maintaining their wellness, or they get some ideas from me as to what they can do to continue to maintain their wellness. So as early as possible, really.
So when does someone need psychiatric assistance? When does someone need?
Okay, so when the symptoms that they're experiencing are causing them a significant interference with their life in some way. So they're either interfering with their work functioning, if they're students with their school functioning. Okay, so when there's a meaningful disruption to your life, then we usually refer to psychiatric help.
Okay, so that's pretty broad. So we know there are medications out there for people with mental illness. The best way to get those medications is through a psychiatrist, is that correct?
Yeah, or a good family physician as well, who is first and has, you know, experiencing in prescribing them. And most family physicians do, because aside from the cardiovascular medications, psychiatric medications are the second most commonly prescribed medications that there are.
Wow.
Right, so very common.
Angela, are you noticing the same things in BC?
With the prescription of medications?
Yes.
Yeah, I mean, I think I see a range of people who are not necessarily personally affected, but yeah, lots of people, just depending on where they are in the range, from healthy to ill, maybe taking psychiatric medications.
So,
sort of help manage their mental health.
Okay, thank you. So I think with the terms of the psychiatric medications, I think, Ali, you're going to speak to our pharmacogenomics, or just what is pharmacogenomics? It's a quite new and evolving field.
Yeah, so essentially it is genetic testing for response to medication. So what this graphic is showing is that we know that there's a lot of different things that will affect drug response, right? And again, this is the kind of the stuff that you have control over versus the things that you don't. And so diet, smoking, alcohol use, those things we know will impact how a drug is metabolized or how you respond to a medication. And then there's things that we can't control, age, gender, we know ethnicity plays a role, and genetics. And so there are for different medications, I think genes play varying roles, and with some medications, you know, the genes aren't a huge factor. For psychiatric medications, that's sort of the most studied area in pharmacogenomic testing, and genetic factors can account up for up to 95% of drug response, variability and susceptibility. So what the pharmacogenomic kind of movement is really trying to use these genetic technologies in order to get people on the right medication at the right dose at the right time. And so taking away some of the trial and error that typically goes into prescribing medications and helping to optimize that therapy based on genetic factors, with the understanding that, again, the genes are not 100% of what impacts the medication treatment, but it can be quite a big role depending on the medication.
Right, so here we have this, a description kind of when Gina was saying that besides cardiovascular medication, antidepressants are the most widely prescribed. Here are some antidepressants and how they are metabolized differently. Is that what this is?
Yeah, so this is just I just took a sample report. So OneOme is the pharmacogenomics lab that we use at MedCan. And basically what this is showing is, this is a report that you get after you do a blood or cheek swab test to look at the versions of the genes that you carry. We know that some people are less likely to either respond to or will be at higher risk for side effects of certain medications. So all the ones that you see in the red category here for this individual, we would say, these are medications that we know you're not going to metabolize normally. Ideally, you would start with medication that's in that green section that we know metabolism is normal.
And how long does it take if someone is prescribed something by their physician, they find out through this test that they are most likely to be better matched to one of these drugs? How long will they know? How long will it take for them to know that it is working?
I think that depends on the medication, and in some cases it's 6 weeks before you really know for sure. And so that's one of the things with psychiatric medications. There's a lot of weaning off, and you try one and then it's not working, and you try another one, you're having side effects, and so it's a lot of back and forth. And I think the stats show it's an average four medications that someone will try before they get on the right drug.
It sounds like it could be really frustrating.
Yeah, I think it is frustrating, and it's a lot of time, and has a big impact, I think, on quality of life. So if we can use this information to help people avoid that process, that's what we're trying to do here.
Psychiatrists will usually wait between that sort of 4 to 6 week window to determine whether or not a medication is working for somebody. So as Ali said, the average trial of antidepressants per person is 4 trials, 4 different medications, right? If you do that math, conceivably somebody could be waiting for months and suffering for months, right, with their symptoms because the medication is not working for them.
Right, that jar
Right.
is not getting bigger.
It's not getting bigger.
It could be getting smaller. The stress could be increased if you're having negative side effects. So.
Sure. And the illness could be progressing during that time as well.
Right. Okay, well, this is really important stuff, and this is, I guess, another slide, a different type of medication for psychiatric conditions.
Yeah.
Okay, excellent. So we want to let everyone know that if you do have questions about genetic counselors, so Allison Hazel is a genetic counselor, Angela Inglis is a genetic counselor. These are some resources that you can go to if you want to know more about genetic counselors. And Angela does train people in this group to be more focused on psychiatric genetic counseling. So now we're going to turn to questions. If you haven't had the chance to submit a question throughout the presentation, this is your time to do that now. While we are reviewing the questions, I'm going to take a few moments to share our offer with the webinar registrants today and describe some of the service that we offer today at MedCan, which was mentioned, and how we can support your strategies with regards to your mental health and your genetic screening if you are interested. So genetic and genetic counseling at MedCan. Genetic counselors provide risk assessment based on personal and family history. We have specialized genetic testing programs here at MedCan. We have including proactive genetic screening, pharmacogenomics, as Ali was mentioning, hereditary cancer panel testing, and non-invasive prenatal testing. And those are just a group. We have specialized genetic testing, personal genetic risk, and a whole range of pregnancy planning and prenatal tests available. So as an exclusive offer for all webinar registrants, we are offering 15% discount on any of our genetic tests. The offer does expire in 1 month. So you will receive a survey following this webinar if you're interested in taking advantage of this offer. or if you'd like to ask us any questions regarding the services we just mentioned, please contact us at medken.com or our genetics coordinator at the number on your screen, or email genetics@medken.com. Now, we also have psychology. Gina is the director of psychology at MedCan. This is part of our Mind Health at MedCan. MedCan offers psychological counseling through our Mind Health services, available in person and virtually. If you are or someone you care about is struggling with conditions such as stress, self-esteem, depression, or anxiety, MedCan can help. Our psychologists and psychotherapists have expertise and experience in individual and relationship counseling. Our team can help you take control of your mind health through high-quality, personalized, customized care. We understand that integrating technology into a team-based approach is important to achieve your overall health and well-being. So please call Paul Takita. His number is on the screen, or you can email him at paultakita@medken.com. Now, we are on to questions. We do have a few. Ali, did you have one of the questions you wanted to address first, or would you like me to read? I have a question about addiction.
Okay.
So a lot of what you spoke to today was related to mental health, but and Angela, if you want to jump in, is addiction, can we find the same conclusions? Can it be passed down the same way?
Yeah, so then I don't know why we do this. I feel like it increases the stigma around addiction, but addiction is a mental illness. And so it does follow the same model in that there's that genetic vulnerability and those life experiences of those stressors. It's just that we know what some of the triangles are. You know, we know that substance use can be some of the triangles that are contributing. So we can see it being passed on in a family, but again, just like depression, just like bipolar, schizophrenia, any type of mental illness, it would never be a guarantee that someone's child would, or somebody who has mental or substance use problems in the family would go on to develop a substance use problem. And I think sort of along with the protective factors or the healthy habits we discussed, having open conversations around mental health, around substance use problems in a family can really help protect somebody from developing a substance use problem. So just even discussing, hey, there might be more of this genetic vulnerability, maybe using alcohol, maybe using cocaine or other substances might affect us differently than perhaps some of our friends.
Thank you so much, Angela. So when we have one question that I know that cannabis is being used in place of other medications to treat anxiety with good results. Is this type of treatment concerning for patients that are genetically predisposed for mental illness by family background?
Sorry, should I?
I don't know. Yeah, go ahead, Angela.
Okay, sorry. So for some people, using marijuana can help them with their anxiety. Other people, anecdotally, I've heard it makes them feel more anxious. The concern with using cannabis is if there's a family history of psychosis or a personal history of psychosis, we know that cannabis can contribute to either experiencing a relapse or it can contribute to, it can be some of those triangles that can contribute to someone developing psychosis like schizophrenia or bipolar disorder with psychosis or something like that. So that's the concern with using cannabis if there's a family history of a psychotic disorder.
All right, thank you so much, Angela. We're going to go to our next question. This one for Gina. Can you speak to techniques for managing stress? At what point do you prescribe medication?
Okay, so in addition to, I guess, the other good self-care things that we talked about, right? Make sure that you're getting regular sleep, eating healthily, exercising, because those are all stress management techniques. We also know from research that one of the best things that you can do to help manage stress is a technique called mindfulness. I know we had a webinar on that not too long ago here at MedCan, and that's a practice that you would practice daily, but the nice thing about that one is that it doesn't require a lot of practice or a lot of time. You just need to practice 10 minutes a day, and there's a lot of actually great apps right now that you can download to help you to practice. So it doesn't have a huge time or cost investment. And the second part of the question, when do you seek help, or when do you ask for medication?
At what point do you prescribe medication?
Do you prescribe medication? I would say, well, that answer is multi-pronged. So either when you've tried non-pharmacological methods and they're not working, or they're not working as well as you'd like them to, or you have to look at severity. So, for example, let's say somebody's experiencing depression. We know from the research that with more severe levels of depression, you need both the self-care, but you also need psychotherapy plus medication in order to relieve the symptoms more effectively. So we also look at severity as well. It would depend on whether you're classified as mild, moderate, or severe.
Yeah, so the research has shown that if you have talk therapy plus medication, it's more beneficial than just individually.
Correct. That would be for all levels of severity. So clinicians, we use mild, moderate, or severe. But with the severe, that's especially true, that you need the medication piece as well, in addition to the psychotherapy.
Well, thank you so much, Gina. We have one last question. I'm going to direct this to Ali. Is pharmacogenomic testing ever covered by provincial plans, or is this an out-of-pocket cost?
So it's definitely a good question. Right now, it is not in Canada covered by any provincial plans that I'm aware of. I think the general sense is that will change over time, and as more people do pharmacogenomic testing, the research becomes more robust, and we're able to show kind of some of the economic data around it. I think it will be something that is covered. So primarily right now it is out of pocket. There is a research program that CAMH runs. They do some psychiatric pharmacogenomics under a research protocol, so that's not paying out of pocket. And we are seeing some companies, employers, maybe private insurance starting to cover it as well. So yeah, the quick answer is not right now, but we will probably see that down the road.
Okay, well, I want to thank everyone who joined us today on their lunch hour or morning hour if you're in Vancouver. Angela, thank you so much for joining us from British Columbia. Dr. DiGiulio, thank you so much. And Allison, thank you. I want to wish everyone a very happy International DNA Day. You will be receiving a survey, and we will follow up with a recap within the next 24 hours. So thank you very much, and hope you had a wonderful time.